Good morning, everyone. Myself, Dr. Mariam. So, today we are going to discuss the topic chronic obstructive pulmonary disease, that is COPD. So, it is basically a respiratory disease. It is a condition characterized by the persistent, irreversible limitation of airflow through the airways and lungs. So, simplifying, we can tell it is like difficulty to breathe. That is, less air flows in and out of the airways of the lungs because of the many reasons that we'll be discussing in the further slides. So it is a long term disease which worsens over the time. So COPD, it consists of a group of condition, that is chronic bronchitis, asthma or COPD, or emphysema. So basically few people will have, like, we will be having the asthma with combination of COPD, and commonly we'll see in people the chronic bronchitis and emphysema. So here chronic bronchitis, it is defined as the chronic productive cough for 2 years, successive years continuously in a patient in whom other causes of chronic cough have been excluded. Means when the patient you have cough, chronic productive cough continuously for 2 years, excluding the other causes. So that is bronchitis, that is inflammation of the bronchioles. So next is emphysema. So coming to emphysema, it is the abnormal and permanent enlargement of the airspace distal to the terminal bronchioles, that is accompanied by the destruction of airspace walls without fibrosis. So we'll discuss about emphysema and how it is the pathophysiology, what happens in COPD, what happens in the structures. We'll be discussing in the pathology part. So coming to causes of COPD. The COPD, it is caused mainly because of smoking, long-term exposure to irritants, that is secondhand smoke, air pollution, dust, fumes, biomass production, that is wood smoke, etc. And one more thing is alpha 1 antitrypsin deficiency. So this deficiency can also is associated with the with 2% cases of COPD. So alpha 1 antitrypsin, like in this condition, the body does not make enough of a protein alpha 1 antitrypsin. So basically, this alpha 1 antitrypsin protects the lungs from the damage caused by the enzymes, protease enzyme, such as the enzymes names are elastase and trypsin. So these two enzymes, it protects the lung from these, the antitrypsin protects the lungs from the damage caused by these two enzymes. So this can be released as a result of an inflammatory response to tobacco and smoke. So basically these two enzymes, it is a enzyme that cause damage to the lungs, and alpha 1 antitrypsin protects the lungs from this damage. So coming to respiratory infections. So respiratory infection, it does not cause COPD, like influenza, pneumonia. These are not the causes of COPD, but these condition can worsen the COPD disease. So coming to signs and symptoms. So signs and symptoms, initially there will be no symptoms or mild symptoms, then shortness of breath, wheezing, chest tightness, ongoing a chronic cough, difficulty to do our daily routine activities like climbing stairs or exercise. So these difficulties can lead to fatigue, weight loss, muscle pain, and there are the main point is chronic sputum production. There will be n number of sputum production during in this condition. And people with COPD can experience a variety of the above symptoms, and these can be divided into 3 stages also, like mild, moderate, and severe conditions. So next, pathology. So normally the normal function of lungs. So how it happens is, like, when air is inhaled, it travels through the windpipe, that is trachea, and then to the airways or bronchial tubes of lungs. So inside the lungs, the airways has branches like smaller tubes. It is called bronchioles, that is rich in blood supply. So the ends of these bronchioles have a billions of tiny air sacs called as alveoli. So normally the walls of these air sacs and airways are elastic and flexible. So inhaling causes each air sacs to fill with air, and exhaling cause each air sacs to deflate. So efficient uptake of air into lungs provides oxygen to blood, which is then carried to all parts of the body. So this is the normal functioning of the lungs. So in case of COPD, the airways become thickened and inflamed and produce more mucus than usual. So because of this production of excess mucus, there can be clogging. Like this mucus can clog the airways and make it hard to breathe. As you can see in the picture, bronchitis, normal bronchi and bronchitis, you can see the difference, how the walls are thickened and the mucus production. So in COPD, the walls of air sacs are damaged and it loses their elastic quality. So the air sacs, when it lose the quality of that elastic quality, it can become like floppy, broken, or it can lose the shape. As you can see the in picture, like healthy lungs and COPD lungs. You can see in COPD emphysema, the air space, the alveoli are like they are enlarged, it gets larger. So the when the air space gets larger, the air gets trapped and there are fewer air sacs to supply oxygen to blood. So because of this air is trapped in the air sacs, it is difficulty for lungs with COPD to deflate like the normal lungs. So the trapped air makes harder to get fresh air into the lungs and makes breathing more difficult. So this is how the pathophysiology of COPD works. And it is to sum up, we can tell, because of the first reason, because of airways and air sacs, it lose their elastic quality, it can lead to COPD. And next one is the walls between the air sacs are destroyed. Then third, airways wall thickness, it will reduce the thickness, airways wall gets thick and airways are narrowed by the inflammation. The fourth point, airways make more mucus, which can lead to clogging and it can lead to the difficulty in breathing. So next, coming to management. So management of COPD, there are no like perfect cure for COPD. Like you can maintain, you can take steps to feel better and stay more active and slow the disease progression. So management, it can like smoking cessation, bronchodilators, glucocorticoids, and there is a combination therapy of long acting beta 2 agonist and inhaled corticosteroids. So these are the combination therapy, and other treatments like antioxidant agent, mucolytes, and oxygen therapy. Oxygen therapy, it will improve our survival, exercise, and etc. Then nutrition, pulmonary rehabilitation, and in worse condition, like you can, in severe condition, you can go for surgeries like bulectomy, lung transplantation, lung volume reduction surgeries. Next is complication of COPD. So complications like pneumothorax, cor pulmonate, exacerbations of COPD, respiratory failures, these can be seen in the severe conditions of COPD. Like what are the comorbidities? So COPD patients, they are at increased risk for CVD. CVD is like cardiovascular diseases, osteoporosis, respiratory infections, anxiety and depression, diabetes, lung cancer, bronchiectasis. So these are the comorbidities where the patients with COPD are at increased risk. So this is the this is what in briefly I have explained the COPD, what is COPD and what are the pathophysiology, what are the signs and symptoms and the conditions. So thank you for patient listening. Have a nice day.